We will be covering a variety of topics today. We will be talking about consents, listing, transplant, change of lifestyle, medications, general information, and what to do with your gift. By now, you all should have read the Lung Transplant Patient Education Guide. This was the education book that you received on your evaluation at Barnes. Once again, please read this book. This PowerPoint presentation is a general overview regarding the lung transplant education book. If you have any further questions, please call your transplant coordinator. Paperwork. You will be signing a variety of consents prior to listing for lung transplantation. The first consent will be the consent for the actual lung transplant operation. You will also have to sign a consent form to have bronchoscopies while you are in the hospital. And finally, there is the increased risk donor consent form. This is a consent that is optional, and you as a patient have the right to either accept or reject the option of being considered for an increased risk donor. Please keep in mind with the increased risk donor consent, this has nothing to do with the quality of the lungs. This is only because of the donor's social behaviors. So please remember that all of our donors have been screened for hepatitis and HIV. The testing is negative. However, the donor's social behaviors have put them at an increased risk to transmit HIV or hepatitis to you as the recipient. We will test you on a regular basis if you do accept a donor from an increased risk patient. Listing. Once you have received both medical and surgical clearance, you will get the go-ahead to be put on the lung transplant waiting list. Prior to putting you actually on the list, we will need insurance approval from your insurance company. Your nurse coordinator will tell you if this needs to happen. The insurance approval is a formal check of the documentation for the insurance company, and they pre-approve paying for the operation. When you get on the transplant list is not going to be a surprise. Your nurse coordinator will be in contact with you regarding this. She will officially give you a phone call at the time of listing, and you will also receive a letter in the mail. At that time, we will also make sure we have the correct contact information for you and your support. So we will make sure we have the correct phone numbers that we can reach you at when you are on the lung transplant waiting list. Please keep our office up to date with any changes in this information. The Lung Allocation Score, or the LAS. You will receive a lung allocation score at time of listing. The lung allocation score is how the organs are allocated, and this is determined by UNOS, the United Network for Organ Sharing. The lung allocation score is a mathematical calculation that is determined by all of the testing that you have completed here at Barnes. The score ranges anywhere from 0 to 100. 100 is the highest score, the highest priority of an organ. However, keep in mind, no one is a 0 and no one has a score of 100. So how the lungs are allocated is based off of where the donor is located and off of the blood type of the donor. So depending on the donor location, the lungs are offered where that donor is located and then the blood group. So then it expands then from that donor location. Besides the blood group, we also do look at initially the lung allocation score. Then we also look at the height of the donor and the recipient, as well as the tissue typing. You can speak with your coordinator and physician whether or not you need to be concerned about the tissue typing. Average wait time here at Barnes Jewish Hospital is around 3 months. However, this can depend on a lot of situations. So please talk with your coordinator and your physician if that would be different from you. Communication. It is very important that you have your phone on, charged, and ready to answer at all times. This call can truly come 24 hours a day, 7 days a week. Please also keep in mind, The caller ID on your cell phone may even show a blocked caller. So the caller ID can be a variety of numbers. It's not necessarily going to be one number calling you. So it is very important that you always answer your phone. If you have not already, you need to program our lung transplant office information into your phone as a new contact. So once again, you need our office information as a contact in your cell phone so that you can reach our office. This is the same office number that you will need to use before and after your lung transplant. We have two office numbers. One is a local number and the other is an 800 number. Our local number is 314-362-5378. Once again, that is 314-362-5378. Then we have our 800 number, 800-321-4054. Once again, 800-321-4054. Both of these numbers will get you to our lung transplant office. What to do when you get the call? Time is very precious when you get the call, and you need to immediately come straight to the hospital. If you live, for example, 4 hours away from the hospital, we expect you to be at the hospital in 4 hours. You do not have time to stop and run errands or take a shower. You must come to the office right away. You need to make sure you have enough oxygen with you to get you to the hospital and possibly back home again. You also need to have your insurance card, a medication list, and your photo ID. If you use a BiPAP or a CPAP machine, please bring that with you as well. We do recommend that you have a bag packed and ready to go for things that you may need while you are here in St. Louis. It is also recommended that you put your lung transplant education book with that bag so that you have that and you can bring that with you at the time of the phone call. At the time of the phone call, you can also not eat or drink anything. Please remember our nurse coordinator that will call you in for the transplant will remind you of these things. We just want you to be aware of this now. What to expect. If you have not already had a tour of our hospital, talk with your nurse coordinator about arranging that. You will need to go to the South Campus at Barnes, also known as the Plaza side of the hospital. You have two options regarding parking. You can park in the underground garage, now called the Plaza Garage, previously called the South Garage. It is the underground parking garage located off of Barnes Jewish Hospital Plaza. You can park in the parking garage, then take the walkway over. Once you take the walkway over, you will see the fountain, and the admitting department is right behind the fountain. The other option is to valet park. Please keep in mind, valet parking is only during normal business hours. Either option is fine. Once again, the nurse will remind you which method may be best for you depending on what time you are coming into the hospital. Once you go to admitting department, they will register you in the hospital and sign some papers. From admitting, they will then take you to the inpatient floor. Once you are on the inpatient floor, they will immediately begin the workup for your lung transplant operation. You will be meeting a lot of people. You could be waiting on the floor for a variety of varied time frame. This can be anywhere from a few hours all the way over to even overnight. And this really just depends on the transplant operation, as there are a lot of moving parts in this process. From the inpatient floor, you will then be taken to the holding area. In the holding area, you will meet your anesthesiologist and your surgeon, and they may begin to put IV lines in you at that time. Sadly, on occasion, we have what is called a dry run. A dry run is when we bring you into the hospital, and we get you all worked up and ready to go. And then we find out that the donor lungs, surgery and post-op. The surgery will last anywhere from 6 to 8 hours long. Family, while you are in the ICU waiting room, you will be kept informed on a regular basis by the OR team taking care of your loved one. After the transplant, once the patient is settled in the ICU, family will be taken back in order to visit them. Patients will not look like themselves. Patients will have a breathing machine called a ventilator that will be breathing for them. They will have 4 chest tubes. They will have a lot of IV lines, and there will be a lot of monitors and IVs in the room. Patients also, if they experience any complications or if the surgeons have difficulty accessing the chest, patients may have to go on bypass or ECMO during the lung transplant operation. Patients can also end up on ECMO after the operation. Usually the reason for this is when the lungs are transplanted, the lungs sometimes have what is called primary graft dysfunction, or PGD. In this case, what happens is when the lungs are taken from a warm body to a cold solution, then back to a warm body, the lungs will then become inflamed and they will not work very well and they won't be able to exchange oxygen. In that situation, patients may have to be on ECMO, which then works for your lungs to help with the oxygenation of your blood while the lungs recover from this. In most cases, the lungs do recover from primary graft dysfunction. There are rare cases where they do not. Finally, you will have a transplant team that will round on you while you are in the hospital. This will consist of a transplant pulmonologist, a fellow, a pharmacist. Transplant complications. Transplant is a lifestyle change. Please keep in mind this is a trade-off. You are trading in your current lung disease for being a lung transplant patient. The biggest thing that you need to understand is that you will be on immunosuppression the rest of your life. So when we put new lungs into your body recognizes that those lungs are not yours. So your body will automatically try to fight those new lungs off. When that happens, that is called rejection, and we don't want that to happen. So what we do is we give your body immunosuppression, which are medications that lower your immune system so that your immune system does not fight off your new lungs. Please though keep in mind when we do this, this puts you at an increased risk for infections. So for example, when you are immunosuppressed, you are at an increased risk for picking up things such as the common cold. Also, just like any other medications, these medications have side effects. For example, these medications can mess with your blood sugars and have you become diabetic. One of the medications is also harmful on the kidneys, and that can cause chronic kidney disease. Rejection. There are 2 forms of rejection that can occur after a lung transplant. So remember, rejection is when your body is trying to fight off your new lungs. The first form of rejection is called acute rejection, and the other form is chronic rejection. Your doctor will talk with you more in detail about the forms of rejection. Medications and pharmacy. We just spoke about being on immunosuppression. As far as what medications we use, these are the 3 medications that are our first line of treatment for immunosuppression: prednisone, Prograf, and Celsep. If you do not tolerate one of these medications, there are some other options that we can look at for you. You will also be on other medications after the lung transplant. So for example, if you have high blood pressure going into the lung transplant, you're still going to have high blood pressure after transplant. So you will still have to take those kinds of medications. And at times we may add other medications that you may need to take for an extended period of time, or maybe even short term. And that will just depend on the course of your post-transplant regimen. It is very important that you take your medication. If you do not take your medication, you are at risk for rejecting your lungs. So what I mean by that is if you don't take your medication, then your immune system will start to recognize your lungs, which then mean your immune system will start fighting off your lungs, which then would lead to organ failure. So it is very important that you take your medications and you take them as prescribed. You also need a local pharmacy in the St. Louis area that can help you with the medications after transplant. You should have all received a handout regarding the local specialty pharmacies in the St. Louis area. Please contact them prior to getting a transplant and give them your information and make sure they accept your insurance so that this can already be set up. Transplant is expensive. Sadly, insurances don't always cover all of the medications that you may need, or the copays may be very high. Please plan accordingly for this. You will need to have a home microspirometer after your lung transplant. This is essentially a small home PFT system, and you will measure your lung function daily after transplant and record the numbers. You must follow your trends and report those trends to your lung transplant coordinator. Insurance does not always cover this microspirometer. In most cases, private insurance will cover the cost. However, Medicare does not cover the cost of this. So this would be an example of another thing that you may have to pay for out of pocket. It is very important that you track your readings on your microspirometer and do this as instructed. Transplant support. You will need to have a support person with you after your lung transplant. You will be in St. Louis for a minimum of 3 months post-transplant, and that support person will need to be with you during that time. This can be more than one person, and please talk with your nurse coordinator and the social worker regarding who your support person will be. Support group. We do offer a lung transplant patient support group, and this meets the first Wednesday of every month. This takes place on the 3rd floor of the Center for Advanced Medicine at 11:30. You are welcome to attend this before transplant, while waiting for transplant, and while you're living in St. Louis and after transplant. We also have a mentor program. This is a group of post-lung transplant patients, and they can offer you support and talk with you about their experience while they went through this transplant process. General office information. Our lung transplant business hours are 8 a.m. to 4 p.m. Monday through Friday. Please remember our phones are off 11:30 to 12:30 for the lunch hour. We do have an after hours line, and that would be our general office number. Please remember we have an urgent line, and we also have a non-urgent line. So if you are calling our office after hours and it is a non-urgent matter, please leave a voicemail on our general answering machine. If you have an urgent matter that needs to be addressed prior to the next business day, you can follow the prompts on our phone line that will get you to speak with a live representative who will then page our nurse on call. Please remember, this should not delay a 911 phone call. If there is an actual emergency, you need to call 911 before you call our answering service. Additional information. Relocation. You and your support person must be in St. Louis for a minimum of 3 months after the lung transplant. During this time, you'll be attending pulmonary rehab daily, Monday through Friday. During this time, you will also have clinic appointments, a variety of testing, as well as blood work. As far as donor information, we can only give you the donor age and gender after the transplant has taken place. Patients, you are no longer disabled after 6 months. Therefore, if you are of working age, you can return back to work. You can speak with our social worker regarding vocational rehab if needed. You are expected to go back to work after your lung transplant. If you have any pets, please talk with your doctor. What to do with your new gift? Please do not wait to address a problem. You are a lung transplant patient now. You need to address things quickly. You also need to stay up to date on your health maintenance. You need to see a local primary care physician. You also need to see a dermatologist on a regular basis, as you are at a higher risk for getting skin cancer. And stay in touch with your transplant coordinator. It is very important that you update our office on what has been going on. You also need to be responsible with your follow-up appointments and testing. You have just received a new gift. Please take care of this gift. Just as it has been very important before transplant, it is also very important that you exercise and stay healthy after your lung transplant. You also have the option of writing a letter to your donor family. Thank you very much. This concludes our presentation. Please remember, if you have any further questions, please call your transplant coordinator and they would be more than happy to discuss anything else in detail. Also, please refer to your lung transplant patient education guide for other details as well. Finally, we do have a few resources that may be helpful to you and your loved ones. We have our hospital website as well as the UNOS website to help answer any other questions. Thank you. As well as a nurse coordinator. Average hospital stay is just under 3 weeks. Are no longer suitable for transplantation. If that is the case, we would send you home without a new set of lungs. Please remember this is rare. However, this does happen. But keep in mind, you do not want lungs that we deem not suitable for transplantation. Once you are taken back to the OR, family members will then be taken up to the ICU waiting area where they will wait for you during your operation.